Then you're talking about examination pattern. I told you examination are conducted every 4.5 months or 5 months maximum. It is conducted. So the portion is small, the students will study better. एक उसका proof ये दे सकते हैं, and I can give you references. Right now, our doctors who have studied in China, they are in good positions in Hyderabad itself. One person I should think should bring Saif and let him talk to these student people for a couple of minutes. Saif, he did only 5 years. He didn't complete his course. 5th year, he was completely online. He has to go back to China and complete his internship, write his 5th year exam. Even before that, he has been absorbed in a very good hospital. Premier hospital hai, and he's getting a good salary. So imagine why. Imagine why. Would they be employing a 4th year who has not passed a 4th year, he has 4.5 years in India to that? No, there are a lot of Chinese youngsters who have completed only 4.5 years or 5 years, they are employed right now. They might not be given major tasks, but they are RMO, resident medical officers. So they are working as doctors. So I'm not saying that this is a good thing or bad thing. I'm just saying that the thoroughness of teaching methodology, the thoroughness of conducting examination is so good in Eastern Europe, in China, that they are capable of becoming doctors and start working. Other than that, we can give you plenty of examples. People are going to ask you, what about PG, post-graduation? You can tell them there's examples where students have come back, written PG set exam. They are free to write PG set exam in India. They have qualified and they have become surgeons and MDs. There are examples. We have names. You can give their names. You can give their hospitals where they are surgeons. To give you an example, there's one student called Sajjad. He is right now a major surgeon in Asra Hospital. He came here, he wrote his PG set, he got a rank in PG set, did his MBBS from Zhengzhou Medical University. It's called Chengchao in China. He came back after 5 years, passed his screening test and passed his postgraduate entrance exam, and right now he is an MS. He is one of the top surgeons in Asra Hospital, which is a huge, large hospital. In other words, people are going to ask the question, what about coming back? You come back, you can write your entrance exam for post-graduation. You can write USMLE, which is an exam for United States. You can write PLAB 1, PLAB 2, which is a requirement for United Kingdom, New Zealand and other places. Yes, they can take training. There are a lot of sites which give online training. They don't have to. As a matter of fact, when they are in the 5th year itself, they can write the first USMLE Part 1. Part 1 itself. Part 2 can be written after the 5 years is complete. It needs to take a lot of effort. USMLE itna aasan nahi hai. Don't make it very easy for them, but tell them that if you want to do PG, you can do in India. You can do, if they are going to Eastern European countries, they can, if they want, write the exam for Europe, in France, in Germany, whatever, and they can do the PG if they want to. Difference is language. For example, if they want to go to Germany to write, they will have to know German language, and because Germany they teach only in German language. So these are the things. But PG is open and they can do it. That's another question they ask.